Hi, everyone. May is National Osteoporosis Awareness and Prevention Month. So, what better time to replay this really great conversation I had with Dr. Margaret Nachtigall about bone health? Yep, our bone health. Please listen and share and try your very best to do everything that Dr. Margaret recommends in this episode because we care about you, we appreciate you, and we absolutely, positively love you. Stay tuned. Hello, everyone, and welcome to Gruff Talk, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. I'm your host, Barbara Hannah Grufferman. Before we dive in, just a quick reminder that you can subscribe to Gruff Talk wherever you listen to podcasts, like, Apple Podcasts or Spotify, and you can find it on YouTube and even right on my website, barbarahannahgrufferman.com. And we love answering your questions and love getting your ideas for topics and episodes. So email them to us at grufftalkpodcast@gmail.com. I am super excited because today we're doing another Menopause Cheat Sheet monthly chat with Dr. Margaret Nachtigall, where we answer your questions about your health and well-being before, during, and after menopause. And we also talk through some of the top health stories we think you should really know about. Today, we're going to kick off the show by answering a Gruff Talk listener's question about vitamin D. A new study just came out last week claiming that it doesn't do very much to prevent fractures. This definitely needs our attention because we have always been told that vitamin D helps the body absorb calcium, which in turn helps your bones stay strong. Then we dive right into a little mini masterclass on bone health, followed by a very quick look at some new studies that have just come out in the last week that we really think you're going to want to know about. There's a lot to unpack here, so let's get started. I'm happy, as always, to be joined by Dr. Margaret Nachtigall, who is a reproductive endocrinologist at NYU Langone Health in New York City. She's a leading champion of women's health, especially women in midlife. She's also the medical director of Menopause Cheat Sheet, a newsletter we publish together to help women navigate life before, during, and after menopause. It's free, and you can subscribe by going to www.menopausecheatsheet.com. Hello, Dr. Margaret. Welcome back to Gruff Talk for our monthly chat about women's health.
Hi, Barbara. So good to talk with you.
All right, let's go right into it. We have a lot to cover. So, Dr. Margaret, I have been a huge believer and proponent of vitamin D for many years. You too. I mean, you are too. Reading studies that showed how effectively it helps the body absorb calcium for stronger bones, decreasing risk for dementia. In fact, that's something we covered in the last episode where we were together, episode 10, where we focused on belly fat, and it aired last month. For all of you, if you didn't listen to it, you really should. And vitamin D is good for so many other things. Some might even accuse me of being a pill pusher because I have talked up the power of vitamin D so much. But a new study just came out that has all of us quite confused, to be honest. And a listener from Charlotte, North Carolina sent an email asking us to discuss and advise. So can you please give us the highlights of the study and what you think we should do with this new information?
Well, I have to tell you, I too am a believer in vitamin D. So I have to tell you that before I start. And that is because, like you, I have read so many studies, excellent, well done, controlled studies looking at vitamin D and seeing the advantage for skin and overall health, for mood, for hair, and for bone. This study is a recent study that was published in the New England Journal of Medicine, and it compared users of vitamin D with a placebo group that were not taking vitamin D, and it was looking at different outcomes. One of the outcomes that they were looking at was bone fractures. So this was not a study looking at bone health overall. It was not a study looking at bone density. It was a study about fractures. And of course, fractures is the end result of bone loss. So we don't want to wait until there's a fracture. We want to treat and prevent before there's a fracture. Anyway, in that study, one of the things that I found really interesting is that the mean or the average vitamin D level for both groups was actually a normal level. It was 30. So what that means is the two groups that they were comparing, those that were not taking vitamin D and those that were taking 2,000 international units of vitamin D, they were both taking them with a normal level. Now, they did say that 15% of people had subnormal levels, but we don't know which group those were in. We don't know if those were the groups that weren't taking vitamin D or they were taking vitamin D. So I think what this study showed is that when your vitamin D level is normal, that adding a lot of extra vitamin D did not necessarily change the rate of fractures.
Okay.
But it doesn't say that taking vitamin D doesn't help your bones. In fact, we don't know that. That didn't answer that question. It didn't negate it, but it didn't say it. And the other thing is we don't know about what about if you're vitamin D deficient, which many people are vitamin D deficient, especially living in areas where we're not exposed to a lot of sun or using sun protection, that's a completely different question. And that is not answered by this study. The other thing that's interesting about this study is that some of the people in the placebo group were taking vitamin D, just taking vitamin D at a level that was lower than the amount that they were giving. So I don't think that this answers the question that I want to know, which is what about, does vitamin D improve your bone density? And I think the answer to that has been shown already to be true. So my personal behavior is not going to change. I'm still taking vitamin D and I plan to continue taking vitamin D because I don't think that there's a risk to taking vitamin D, especially in reasonable levels of 1,000, 2,000 units every day. So I'm going to keep taking my vitamin D for prevention of bone loss. And I really don't think that this gives us the answer.
And then what about with your own patients? Will you continue to recommend vitamin D, or will you say, yes, continue with your vitamin D?
I'm going to continue
if a patient asks you.
I'm going to continue to recommend vitamin D for bone health, especially in anyone that has a subnormal level. And it's very difficult to measure vitamin D. Sometimes we don't get a really accurate level of that. But particularly in someone that's not exposed to sun, is not taking people who don't have milk products or that have been fortified with vitamin D. So particularly in that population, I think that it's important to get vitamin D.
I read the study, and then I also read some, because I'm not a physician or a healthcare provider in any sense. And I also read quite a few articles that really reviewed it in more layman terms, like you just did. And the vast majority of doctors who were interviewed, who reviewed the study, said the same thing as you're saying. Like, they'll continue personally to take vitamin D because there are really so many other benefits to vitamin D. So it sounds like this just caused a bit of confusion. I know certainly one of our listeners was quite confused about it. But since, as you put it, there's no risk to taking vitamin D, why not?
Why not? And I think, let's put this in, we'll file it in our minds as a study looking at fracture. And then there are still many, many other studies that we've read that look differently on vitamin D. And remember, it's not only about the bone. Vitamin D, yes, we're taking it for bone health and bone strength, but vitamin D has a lot of other benefits that you mentioned in your introduction. And so I think for hair, for feeling well.
For mood. And again, I'm really intrigued by that study that we reviewed the last time we talked about dementia.
Right.
And more studies keep coming out about vitamin D. I will continue to call it the little vitamin that could.
Okay.
Still.
I'm gonna go along with that with you. Absolutely.
So now we're going to segue right into a discussion about bone health, since we kind of started talking about bone health and what we should all be doing to help keep bones strong as we go through menopause and beyond, right? Now, I was diagnosed with low bone density around when I turned 50. How do I know that? Well, I fell walking my dog, broke my arm. I shouldn't have, and had my first bone density test, and it showed low bone density. Since then, I've been doing everything the Bone Health and Osteoporosis Foundation suggests we do. And, also I have served as a proud board member for almost 10 years, and I'm so proud of that. But there's always new information coming out. And I wanted you, Dr. Margaret, to do a mini masterclass on bone health, starting with a few questions. So here they are. First, what impact does menopause have on bone health and why?
Well, I think that you came right to a really important part, which is that before menopause, ovaries are making estrogen. After menopause, ovaries are no longer making estrogen. Estrogen has a huge role in bone growth and in bone strength, because estrogen helps lay down new bone. And when estrogen is no longer present, the balance of laying down new bone and bone being eaten up changes. And so this is a time that the first 5 years after menopause is a time where there's a tremendous amount of bone loss. So anyone that's starting menopause with any decrease in their bone is going to have a decrease enough that can really be an issue. So this is critical. That time, that first 5 to 10 years after menopause, there's a huge drop. So this is really important that we assess who's at risk. And it's a shame that you had to break a bone in order to find out that you had low bones. Wouldn't it have been wonderful for you had you found that out 10 years, 5 years before, and could have done something about your bones earlier so you wouldn't have had to break your bone when you fell? And that's what I think is important. I think we should really try to keep bones as healthy as possible so that we can prevent fractures.
Right. And in my case, I also wasn't taking hormone therapy, systemic hormone therapy, which, as we know, does help a great deal in replenishing the estrogen in the body, which, of course, is going to help keep our bones strong. And I didn't have that benefit. But, I like to look at that period of my life as the turning point and the silver lining in that event. And it was very painful. And I hated wearing a cast on my arm for a while and all that stuff. But the silver lining for me was that I had that major aha moment where then I started to do everything right for my bones. The eating and yes, the vitamin D to help absorb the calcium. Yeah, I still believe it.
And the exercise.
And the exercise and so on and so forth. And, to this day, 15 years later, it continues to work for me. So, but I agree with you. It's so good to know as much as possible about the status of your health and the status of your bones as early in life as possible. So we already talked about estrogen, and then we talked briefly, I referenced it, the hormone therapy, bringing back the estrogen to help. But what do you think are some of the key things women can do before menopause? And we talked about that window after menopause, so crucial.
Sure.
I mean, that was my window where I made changes. But what about all the women who have not yet gone through menopause? So they still have the good levels of estrogen. What should they be doing?
Well, I think for everyone, whether it's premenopausally or postmenopausally, there's a lot of things that we can do to stay healthy. So number one is not to smoke, because there's no question that people that smoke have a decreased bone density than people who do. So not smoking is critical. Getting adequate exercise, eating a healthy diet, eating a diet that is rich in getting enough calcium, just as you said, vitamin D, which I think is important as well. So not being sedentary. And then there are some medications that increase the risk of bone loss. People that are on chronic steroid therapy, can really decrease the bone. So if you are on steroid therapy, that would be a reason why I would go ahead and get a bone density earlier than, say, somebody else would do. But absolutely. And then also minimizing alcohol intake and overall, keeping healthy. But I think the key thing is the adequate intake of vitamin D, calcium, and exercise is really important.
That is the trio. And also knowing your family history. And that's true of really of just about everything.
No,
but
that's
I mean, if you had a mother or a grandmother or a grandmother who had,
or a grandfather or a
grandfather.
Father.
Sure.
Yeah, absolutely. A history of osteoporosis or bone loss is absolutely a reason why you should be more attuned to these things than anyone.
And also some other risk factors are your body type. If you're thin, if you tend to be a thin woman or person, your risk is greater for bone loss and thinner bones.
Small-boned.
Yeah, or if you lost weight, weight loss is also a risk, as we now know.
Right. And because it's less weight on your bones.
Exactly.
And so, people who are walking, people who are active, that's good for your bones. Having that stress on the bones is a good thing. People that are lighter and sedentary are going to be more at a risk. Absolutely.
Right. And, there are a lot of people, Dr. Margaret, have also, and I understand the reasons why, have gone the plant-based route, strictly vegan route to better health for whatever their reasons are. I know personally I do like every once in a while a ribeye steak, but rare. But what happens is that they don't always get the adequate amount of nutrients for their bones, for their bone health. And so I saw a study actually just this morning that came out about how vegans really need to, more than, well, everybody should, of course, but vegans really need to counter that by doing as much resistance training exercises and strength training as possible. Like this is something, it's a risk. In other words, if you're a vegan, you have a bit of a higher risk.
Well, I think, I didn't read that study, but I think that what you're saying makes complete sense. And I think, first of all, as we said, resistance training is going to be helpful for the bones for anyone, but particularly in individuals who are deficient, say in vitamin D, it would be particularly important. So
or calcium.
Right. And that makes a lot of sense to me. And that sounds like a very good study that I'm glad that people should be aware that there are nutritional deficiencies that can occur. So we should compensate. But while we're talking about people who are at risk for bone loss or osteoporosis, premenopausally, people that have gone long spans without having a period. So people who are amenorrheic because of very low body weight or because their estrogen is very low for any reason, they're also at risk for having bone loss. And other medications that can be added are also at risk. So those are people that should be aware and more ready to add the exercise and other factors to their regimen.
It really, it seems like estrogen is just such a critical component of all of this for women as we start to reach midlife and go beyond. So after this short break, Dr. Margaret is going to do a quick review of some new updates about hormone therapy. Stay tuned. Okay, we're back with Dr. Margaret Nachtigall, and now we're going to talk about hormone therapy. Dr. Margaret, just say the words hormone therapy in a room full of women, and there will be a lot of different reactions and lots of confusion. But now the North American Menopause Society, NAMS, as we call it, has come out with an updated position statement on hormone therapy, hopefully should put a lot of the confusion and anxiety to rest. So in an article published in Menopause, which is the North American Menopause Society's magazine, It's called the 2022 Hormone Therapy Position Statement Advisory Panel. It reaffirmed its support of menopausal hormone therapy for the treatment of vasomotor symptoms like hot flashes, saying the benefits outweigh the risks for most healthy women younger than 60 years and within 10 years of menopause onset. The position statement also emphasized personalized treatment, something that you're always talking about, with a periodic reevaluation to analyze each individual's benefit risk profile. So I got this right from Menopause, the magazine. So Dr. Margaret, give us your thoughts on this new position statement from NAMS.
Well, I think this is really important. I think it's a change from the previous one. I think that it shows the safety of hormone therapy for most people going through menopause. And it really shows that it shows improvement in the symptoms of menopause for hot flushes, for dry vagina, for difficulty sleeping. It showed that it had a decrease in diabetes. It showed that hormone therapy was good for hair and skin. It decreased joint pain. It showed that in patients that started within 10 years of menopause, they had a decrease in heart disease. And it showed that it was beneficial for anyone that was having their ovaries removed prior to the natural age of menopause. And so it really gives us a safety profile. And of course, that it really encourages everyone to get individualized care because it's not right for everyone. If someone does have an estrogen receptor positive cancer, such as a breast cancer, that's not an individual, or someone that has extensive liver disease or has irregular bleeding. But for the other people, it really gives us encouragement that this is a great option for people. And going back to our discussion about osteoporosis and bone loss and bone health, is that estrogen is a fantastic way of protecting the bones. And it's an excellent vehicle to be able to keep bones healthy and strong and decrease the risk of osteoporosis. And even in people that do have bone loss and already do have osteoporosis, estrogen is a great way to be able to restore the bones and bring the bone density up. In fact, there are many other ways of treating osteoporosis and treating bone loss that we didn't talk about earlier.
Right. That's right.
There are
With medication.
There's a variety of medications. Estrogen is one of them. And actually for spine, for people who have low bone densities in the spine, estrogen is the best at being able to restore bone density. For the hip, the other medications have been shown to be equally as good, or some even better, for restoring hip strength. But estrogen has been shown to be an amazing agent at helping us maintain our bones.
But that's really only for, according to what I read in the study or in the position paper, only for women who are under 60, correct?
Yes, but I don't want people to be confused that when they turn 60, they have to stop hormones. It's initiating treatment. So the key thing is when is the last period? When does your estrogen decline? And that's different for everyone. So the average age of menopause is 51. Range is about 45 to 55, and some people are even earlier and even later. So if you start within 10 years of your last period or your last exposure to estrogen, then you're still within the safe range. And I like to start within the first 5 years just to be safe. But then you're going to see this decline and see the improvement that they're talking about. So within the last 5 years of when you went through menopause. If you wait longer than 10 years, then it's not safe. So assuming that the average age of menopause is 51, then you add 10 years, that's how you end up with 60. But if you did start estrogen when you were, say, 51, and you're taking it, it doesn't mean that you have to stop at age 60. In fact, we have some long-term studies showing that benefits continue. But that's something that everyone should reevaluate every year with their healthcare provider. But this position statement shows that, yes, everyone should get their individualized care. but that hormone therapy remained, and I quote, remains the most effective treatment for the treatment of vasomotor symptoms and the genitourinary syndrome of menopause, and has been shown to prevent bone loss and fracture. So that's huge.
That's huge.
That's a
It is the gold
tremendous,
standard.
it's a tremendous statement. And then as you read through, because it's a very long document, but as you read through, you see the benefits in decreasing diabetes, although that's not an indication to start. It did show. And a decrease in skin and fewer wrinkles and better for your hair and less joint pain. I mean, these
and
are
dry
all
eye.
these are, and yeah, but these
My
are all
biggest
things
issue. Yeah,
that
these are all.
it hadn't been actually stated before. So I think
Right.
this position statement is really a big deal. And especially the statement that if started within 10 years, that there's a decrease in heart disease, because a lot of my patients come to me thinking, wait a minute, I'm afraid that estrogen is going to increase heart disease. I want to go on estrogen because I want to decrease my hot flushes and I'm miserable and I'm sad and I'm moody and I can't sleep. And I know estrogen is going to be good for my sleeping and my mood and my hot flushes, but I'm worried about my heart. And sure enough, now we know that they're actually, if you start early and you start as soon as possible, that you're actually going to have a decreased risk. So I think this is a really, really big statement.
It's really big news in the world of menopause. And I think that this hopefully will make more women less confused and more comfortable.
I think it's really hard because it's a big decision. And I think that sometimes, well, of course, it's great to have that conversation, but I think, yes, it's an awareness that this is a possible solution. And then to think about it. And also, it's okay people can start and then stop. If they want to begin some hormone therapy and see if it really does make them feel better. And then if they want to stop, they can stop. You're not saying I need to go on for 10 years. It's optional.
Right. Thank you for that overview. Really good news. And so we covered a lot of very interesting studies that have been coming out in the last really week or two. But something caught my eye this morning, and it happened to have been in the New York Times. I just want to share it with you all. The headline read, "Just 2 minutes of walking after a meal is surprisingly good for you." Now, that's really good news because a lot of people don't want to move too much. But previous studies showed that taking a 30-minute walk after dinner, for example, would help keep blood glucose levels at a low or normal level. But now it seems you only need to walk for about 2 minutes to get the job done. Well, I still say you should do more than that. What do you say, Dr. Margaret?
Well, I just think it's great to hear that it doesn't mean we have to stop at 2, but I think it's great to hear that even 2 make a difference. And I think that you do as much, if you can do 2, great. If you want to do 3, that sounds good too. If you want to do 5, that's okay. My sister, who's a very big runner, always told me, she said, even if you don't have time, any amount of exercise is good. So if it's 1 minute, 2 minutes, 3 minutes, do what you can. But it's great to get the reassurance that even 2 minutes is good. I don't think they're telling us to stop, though.
Exactly right. And, this is something that you've heard of, the blue zones where, all the places around the world where the people live the longest, and that have been really studied very intently. And one thing that they all have in common, they have many things in common. One of them is that they all take that constitutional walk after each meal. Yeah. So I clearly there's
walk
some
it off.
Walk it off. Exactly right. Walk it off.
Walk it off.
Such good information as always, Dr. Margaret. Thank you. We'll be meeting up again in a couple of weeks for our next show next month. We'll have links to all of this good information in the show notes, everyone, and also on my website, barbarahannagrufferman.com. And again, please send us your questions. We love to hear from you. Send them to grufftalkpodcast@gmail.com. Dr. Margaret, before I let you go, do you want to share maybe 3 really cool takeaways from today's discussion?
Yes, let's summarize. I think for bone health, the time of menopause is a time where there's going to be a lot of bone loss. I think that it's a good idea to assess your risks and see if you're someone that might be at an increased risk for developing bone loss. So if you're anybody who's menopausal and doesn't have estrogen, they're at risk. Yes, go ahead and get a bone density. Anyone that's over the age of 65, get a bone density. Anyone who's very sedentary, anyone who's smoking, these are all reasons to go get investigated earlier rather than later and get your bone density. I think that there are many things that you can do to be preventative. We talked about not smoking, not drinking a lot, getting exercise, getting vitamin D and calcium in your diet. And then I think also getting a bone density when appropriate. And then we didn't touch on treatment a lot, but think for people who do have low bone densities to think about there are many, many options for treatment. And that preventative is our best thing, because it's unfortunate to have to get to a fracture, and fractures are painful, costly, and they can be dangerous. And so whatever we can do,
especially if it's a hip fracture in a very elderly person.
Whatever we can do to prevent that, I think is really, really important. So as always, I take your model, which is to really try to be as healthy as possible.
Amazing as always, Dr. Margaret. Thank you so much. Well, we will convene again in a month. Talk to you soon. Thanks for tuning in, everyone. If you enjoyed this episode of Gruff Talk, please do 2 things. First, share it with all your friends and family, and subscribe to Gruff Talk wherever you listen to podcasts, including YouTube, so you never miss a single episode. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.